right. Welcome to the April 24th, month of April, Revere Board of Health meeting. Please everyone stand for the Pledge of Allegiance. So again, welcome to the month of April 2025 Board of Health of Revere Public Meeting. I am the chairperson, Dr. Drew Bunker, and to my left is Kathleen Savage, board member, and to my right is board member Viviana Catano. Also staff, invited municipal staff is Lauren Buck, who's Director of Public Health, Michael Wells, who's Health Agent and Director of Inspectional Services, Paula Sepulveda, who's the Board of Health Clerk, and Anthony Galizia, Assistant Superintendent of Water and Sewer. First topic, we're going to review and approve the minutes from the March meeting. So,
I approve the minutes as written.
I approve of the minutes.
Great, thank you guys. I approve them as well. Next is going to be the Public Health Communicable Monthly Report with Lauren Buck.
Thanks, Dr. Bunker. For April 2025, our communicable disease burden is very low comparatively, so I'll skip right to state and national public health updates. According to the Healy administration, Massachusetts is expected to lose $100 million of public health grant funding from the recent federal cuts of the Center of Disease Control to the CDC. Additionally, the state's Department of Mental Health is expected to lose funding from the Federal Substance Abuse and Mental Health Service through terminated grants. Much of the CDC's cut funding supports the state's public health laboratory, including testing for respiratory diseases such as bird flu. It's currently unclear if there will be any effects on the programs utilized by Revere. We luckily don't have a ton of federal funding, but I will keep everyone updated in terms of cuts that affect the city of Revere. And I just wanted to give an update on the City of Revere Health and Human Services programming for the upcoming months. I just wanted to talk about the spring pop-up market that's in collaboration with HYM and Suffolk Downs. Our first market was held on Saturday, April 19th, so last Saturday. It was a great success. We have 2 more upcoming spring pop-up markets, which will be held on May 17th and June 21st. They're from 11 to 2. They're located at Beachmont Square, which is the new located on the new kind of square in front of the Amaya building that was just built over by the Beachmont T-Stop. And we also are running a limited supply SNAP match program at the remaining 2 spring markets. So please stop by if you shop for fruits and vegetables using your SNAP or EBT benefits. Our summer's farmers market is also returning to Waterfront Square on Revere Beach starting July 11th. That will be every Friday from 11 to 3 except for July 25th. So every Friday from July 11th through September, except for July 25th from 11 to 3 at Waterfront Square on Revere Beach, the same location we were at last year. We're hoping to have more vendors this year, and we're having entertainment at each event. Our produce vendors all accept SNAP, HIP, senior vouchers, and WIC vouchers. Our substance use and homelessness initiatives office will run several campaigns over the next several months. Our overdose memorial and awareness vigil will be held at the end of August, as it is every year. We will also do a Stomp Out the Stigma Summer Barbecue for the second time. Our first one was last year. It was a great success. It will be a speaker series as well. That will be held in September as part of a series of events for Recovery Month, which September is Recovery Month. The community gardens open May 1st. There's currently still a significant wait list. So if you're still on the wait list, it's because there are so many on the wait list. Contracts, fees are being collected as we speak until May 31st. Our community liaisons are going to be hosting their second annual resource day in September. It was a great event last year, and it brings together a lot of different organizations who specialize in social services. Finally, the Lifesavers League is a program that we premiered in early April. Our first session was April 3rd. This is a community-based emergency preparedness program. It teaches residents things like hands-only CPR, be ready, fire safety. Moving forward, it will be a quarterly program. We'll offer in multiple languages, and we'll have childcare offered at each sessions. We'll vary the topics depending on what time of year it will be. Our next session will be held in late June. There will be more information on that coming out soon. And finally, just anticipation of the summer, we'll do some more heat awareness programming this year, a lot of communication via social media. And that's it.
Great, thank you, Lauren. Next is the Inspectional Services Monthly Report with Michael Wells.
Thanks, Dr. Bunker. Inspectional services, inspections for the month of April are as follows. For the Interior Housing Division, we performed 39 certificate of fitness inspections, 5 re-inspections of certificate of fitness, 7 interior complaints in process, 2 interior new complaints, 2 interior complaint re-inspections, and 1 pool spa re-inspection. On the Food Inspection Division, we performed 31 routine inspections, 8 re-inspections, 6 complaint inspections, 2 pre-opening inspections, and 11 temporary food service permits were issued. On the Exterior Sanitation Division, violations issued for accumulation of litter, trash, and debris were 46, 1 violation for carts out at improper times, overflowing dumpsters were 22, improper placement of garbage, trash, and bulky items were 317, 1 violation issued for improper signage on public property, 5 violations issued for junk heaps, dumps, and automobile graveyards, and 1 violation for road and harborage. Also, 6 violations for unclean, unsanitary land, and 1 violation for sump pump violations. I just want to mention that this weekend, Mayor Keefe is presenting the Beautify Revere for this coming Saturday, urging all residents to come out and help clean up the community. And also, we urge the residents and business owners to start to, as the weather starts to get nicer, to take a look at your properties and ensure that they're in good shape and freshen them up a little bit for the community.
Great, thank you, Michael. Next is going to be the lead service line test pits. I'm going to have Anthony Galizia come up.
Anthony Galizia, Assistant Superintendent of Water and Sewer. Dr. Bunker, the board, thank you. Just to give an update, we began last week test pitting again for unknown lead locations and working to confirm the material of those lines. We're scheduled to perform approximately 350 to 400 excavations over the next 6 to 8 weeks to verify those materials. And we're also scheduled to begin a project further this summer to remove known lead lines. The city has to remove 82 lead services this year to remain in compliance with the changes to the lead and copper rule and the lead and copper rule improvements. We are proud of the work that we completed last summer. We removed 77 lead lines and worked very hard to bring our unknown numbers down from a starting point of 1,900 down to about 550. So our unknowns, as they continue to decrease, the amount of lead lines that we have to remove is also decreasing. So our efforts have been focused on clearing the status of those unknown lines and removing as many known lead lines as we can as the schedule permits.
Thank you. Any questions from the board? Comments? No, it just sounds like you guys are doing some good work, and keep it up.
Yeah, thank you. Just to add, we're also trying to enhance our communications with residents. Information has gone out about the known risks of lead. There's also a lot of information on our water and sewer website. There's also an interactive map where residents can type their address in, and a small dialog box will show you the status of your line. So if any residents have questions or want to know, they can look at that inventory map, and that map's also changing in real time as we uncover the unknowns and confirm the status of those. Thank you.
Actually, Anthony, can I ask you a question? I think a while ago, we received some sort of letter letting us know if the city thought there was any lead lines near our house. Is that correct? Was that accurate? I feel like we received something in the mail maybe a few years ago. Is that true?
Yeah, 2 years ago, there was an exception in Revere to the lead. There were a couple locations that came back with high counts, so we had to send out a letter to every resident. But the changes last year to the LCR and the LCRI, state and federally require every state now through the town to provide a certified inventory of our service line materials. So this process now that we're beginning is helping clean up that inventory and have as much accurate information as possible.
And remind me, where can we go check to see the status of whether there are any lead lines near our house? What did you say that was?
So if you go to Revere.org
Okay.
and go to the water and sewer page,
Okay,
there's a few notices with information about lead, and there's also an interactive map that you can click and just type in any address and see the status.
and for the residents, these lines were put in place before it was known that this was dangerous? Is the city just replacing like old lines?
Yeah, so the city is confident that they stopped using lead around the 1950s. So there are just significant older parts of the city that were put in pre-1950 where a lot of these lines are from. Nothing new has been installed lead. It's illegal. Nobody allows it. Federally, it's not mandated. So anything that has lead is of significant age. And that's part of the difficult process where confirming the records are from so long ago. A lot of those records weren't in the most accurate shape. So these test pits help us get field verification where we can see with our own eyes, get good pictures, and determine what's out there.
And out of curiosity, is there something that residents can do if they do hear that there's a lead line near them? Like, is there any precautions that they could take? Anything that you would advise or that the city is currently advising?
Yes, so the city is committed to replacing all lead lines for free, no cost to the homeowner. So if a lead line is discovered, the resident's informed. We also deliver them a pitcher filter that can filter out the lead for them. We advise them what not to do, what they can do. There's also, if any residents have concerns, they can also, the city will not sample that water, but they can have it sampled at the Northeast Laboratory in Danvers. But the city is, as I mentioned, 77 lead replacements last year at no cost to the homeowners. And we continue to replace those lines at no cost. It's completely free. We do that work ourselves or with the help of a contractor. And any resident that has lead in the meantime, we have those filters for them available at the DPW.
Thank you.
You're welcome.
Great, yeah, and also I think if there is concern from the person, they can go to their physician and get their lead level checked. But as someone who has a patient who works in the lead removal business, even then their lead levels are in a low enough level to have no toxicity. But I'm not sure if you can comment on that.
I can. We certainly advise all residents if they do have concerns that, as you mentioned, these things do come up in regular, physician visits and getting their blood panels. It's really the only way to tell. But yeah.
Thank you. All right. So next is going to be the heating variance requests. I think I'm going to move that over to Michael Wells. Thank you.
Thanks, Dr. Bunker. As we do every year, we have 6 properties that submit an application for a heating variance. Per 105 CMR 410-201 and 410-840 of the state Massachusetts Sanitary Code, heat can be turned off from May 31st through September 15th. As we are encountering warmer weather and climate change issues, we have warmer springs and warmer falls. In the 6 properties that have applied, also work off of one system in their entire building. So they're able to switch over from air conditioning to heat because the one system controls the entire building. Those 6 properties, the Breakers condominiums located at 474 Revere Beach Boulevard, Friendly Garden Co-op located at 235 Revere Street, Ocean Gate condos located at 382 Ocean Ave, Seaview condos located at 510, 515 Revere Beach Boulevard, St. George condos located at 350 Revere Beach Boulevard, and Sea-Watch Towers condos located at 376 Ocean Ave. A majority of vote of the residents was submitted by property management, and as always, room heaters must be available upon request to any resident that may request one. We kindly request that the board authorize the heating variances for 2025 for those 6 properties.
Yeah, so I'm going to approve those heating variance requests. Ask the other board members if they approve as well.
I also approve.
Same.
Okay, so that's 3 of the 3. Approve. Thank you.
Thank you.
Excellent. Last topic is going to be the body art temporary license. I'm going to give it over to Lauren Buck.
Thanks. So we just have a body art establishment application and individual practitioner application for a temporary one-time event. If you all remember, we did a series of events with Boston Harley and a specific tattoo artist who's also licensed out of Danvers, David Martinelli. This is just an additional date that they're adding on to kind of his body of work at Boston Harley. So the temporary license establishment is for Let or Rip LLC and Boston Harley Davidson at 646 Squire Road. The inspection was on April 17th. The event date for the temporary license is May 10th. He passed inspection, so we're recommending that you approve that license and also approve the license for the individual practitioner of David Martinelli on 12 Beaconsfield Street in Lawrence. His inspection occurred on April 17th, and the event date is the same, May 10th. Passed the inspection, so we recommend that you approve both of those temporary licenses.
Great. Yes, I approve both licenses. Other board members?
I also approve both licenses.
I approve as well.
Great, thank you. All right, well, that will conclude this month's meeting. Thank you.